the way this will work is you log on to this one website. If you don't have the web, you can roll other ways, but most folks will use the web, and you can log onto the one web portal, and you'll see all the healthcare insurance options that are available in your area. So you'll see, here's all the insurance companies, here's all the products that they're offering, and you'll be able to compare and contrast them on price, on quality, on provider networks, all that sort of stuff. So it should be easier to do a real apples to apples comparison of what one company's offering versus what their competitors are offering. Today, their plans are intentionally designed to be slightly different from what their competitors are offering. So you, as a consumer, have a real tough time, accurately judging, well, which one's better, which one's cheaper. That will change if you're buying through this exchange. The plans will be organized by level. So there's a bronze, silver, gold, and platinum. Each one of those will be defined. And then you can look at the definition of each one of those tiers and decide, okay, I want a gold plan or I want a silver plan. Say, show me the silver plans, and they'll show you a list of plans that are all more or less the same, and you can figure out where to go from there. The web portal will feature a calculator, so you can figure out how much is actually going to cost me. Here's the monthly premium, but what about the deductibles, and what about the co-payments, co-insurance, and sort of give you a real idea of what this is actually going to cost you or your employees, on a month-to-month basis. And then you can, pick what plan you want. You can sign up. The exchange is the one that interacts with the insurance companies and sort of handles some of the administrative processes so that you don't have to worry about that. So there's two sort of sides to the exchange. One is for individuals, and one is for employers. So if you're an individual, you can buy through the exchange for yourself, for your family, or if you're a small employer, you can also buy through the Small Business Exchange for yourself and your workers. And they are opening on January 1st, 2014. They'll start doing pre-enrollment in the fall, but the coverage will take effect in 2014. And they are voluntary. So you have to have insurance, right? But the government doesn't care where you get it from. You can use these exchanges if you want, but nobody is required, to use these exchanges. It's just there to be another option for you as an individual or as a business owner. Interestingly, the only group that is required to use the exchange are members of Congress. So when they pass this law, they sort of put their money where their mouth is and say, hey, we think these exchanges are going to be the way to go. And in order to prove that, we're going to require ourselves and our staff to get our benefits through the exchange. So that's where they'll be getting their benefits next year. And if you want, you can buy the same plan that your member of Congress buys. Exchanges are designed by the state, so there'll be an exchange in all 50 states, and the federal law sets up some guardrails that states have to play within, but most of the policy decisions and operational decisions are left to the state. So here in California, our exchange will be designed to reflect the needs of our economy, of our healthcare system, of our uninsured, of our employers, and will look very different from like the Nebraska exchange, for example. So it's not like it's a one-size-fits-all approach. Every state gets to innovate and come up with whatever they feel is the best approach. Some states, for a variety of reasons, have declined to set up their own exchange. So in those situations, the feds will step in and do it for them. But California is not one of those states. We're doing it ourselves. And then lastly, this is not a new concept. So the idea of an exchange or a purchasing pool for individuals and small employers has been around for a number of years. It's something that the state of Massachusetts already has. They've had that for about 6 or 7 years. The state of Utah has one. And there's also a lot of exchanges in the private market as well. So it's not just a government thing. A lot of business groups, chambers of commerce type groups offer exchange products. There's one in California that's run by brokers. It's called California Choice. And there's a very successful program in New York and Connecticut. So this is not something that Congress dreamed up a few years ago. It's something that has been around for a while and is now being tried on a bigger scale, if you will. So in California, our exchange is not called an exchange. It's called Covered California. We like to come up with cool names for our programs here. So it's called Covered California. California was actually the first state in the nation to enact a state exchange. Back in 2010, California was the first state that says, hey, we'll do this ourselves. And they got the ball rolling immediately. It's governed by an independent board, so all their meetings are in public. They have to announce their meetings in advance. They're not allowed to do anything behind closed doors. And they have board meetings all across the state. Most of them are up in Sacramento where I'm based. And there's a microphone in the front of the room, and they let people line up and tell them what they think. And they take public comment after every item on their agenda. And people say you're doing a great job or you're doing a bad job. They listen to their ideas, their feedback. So it's a very open and transparent process. And they're just getting ready for open enrollment that's going to start in the fall. And they're trying to work as fast as they can and hire staff as fast as they can and build this new IT system as fast as they can and get ready to go. They were just in Los Angeles a few weeks ago. They met downtown. And there's a lot of community groups, business groups, all there to sort of be a part of the process and to chime in. So it's a very open and transparent process for folks that are interested in weighing in. A few decisions that California has already made. Number one is what's referred to as an active purchaser. So I mentioned that the federal government sets up these guardrails and the states get to play within those. So what California decided to do is that California's exchange will actually negotiate with the insurance company. So on price, quality, all those sort of things. So the exchange will be able to sit down and say, hey, we've got 3 million people enrolled in our exchange or whatever the number is. And when they sit down with the insurance companies, they'll say, hey, if you want access to our 3 million customers, we're looking for this sort of price. We're looking for this sort of quality. And they'll negotiate back and forth, and they'll settle on a rate, and they'll settle on a product or whatever. As opposed to an exchange that says, hey, anybody that wants to sell in our exchange, come on board. So they'll be more discriminatory in deciding what sort of policies are being sold, what sort of standards and pricing they're looking for. So basically, the rates will be negotiated much like a large company would do today, or the government does through CalPERS here in California. Those are all negotiated rates. So it's basically that sort of concept. On the small business exchange, employees will be able to select their own insurance company. So in today's world, you have 10 employees, you're a small business, you usually get to offer them one insurance company, maybe two, depending on your size. If you're buying through the exchange, the employer can select the level of coverage that they're willing to pay for, and the employees can select any insurance company within that level. So if you have 2 employees that want Kaiser and 2 want Health Net and 2 want Anthem Blue Cross, they can all do that, and then the employer just writes one check, every month to the exchange, and the exchange handles it from there. So basically, this sort of choice is normally reserved today for large businesses. Again, government through CalPERS, they can offer their employees a choice of plans, something that small businesses typically don't get to do, but they'll be able to do it through the exchange. Brokers, a lot of brokers, when the healthcare law was first enacted, were worried that these exchanges were going to put them out of business. At least in California, the exchange has said, hey, we like brokers, we want to work with brokers, we feel that they're an important part of the process. So brokers will be selling exchange products and non-exchange products. So if you use a broker today, you can continue to do so, and your broker will still get paid just the same. They're also looking at including some additional HR services for the small business exchange. So recognizing that most of their customers are going to be probably pretty small businesses, 10 or fewer employees will be probably the majority of them. And for the most part, those guys don't have HR departments. So what the exchange is willing to do is be the one to handle your COBRA administration, to do your HSAs, your HRAs, your wellness plans, so you can sort of take that burden off of the employer and have the exchange do that as sort of a value-added service that they're willing to provide. And I mentioned that the board governing the exchange is public, and they have to do everything in daylight and conduct business and where folks can weigh in and all that. But they'll be partnering with private vendors as well. So in terms of building the website, administering the helpline or the call center, it's not going to be staffed by government workers. The Small Business Exchange is looking to partner with a private sector sort of partnership You're looking to, firms that sort of know something about doing this kind of thing. Here's some sites I'll leave up for you to get more information if you're interested. Our website is smallbusinessmajority.org. I mentioned the tax credit at the start of the presentation. If you think you might be eligible, there's a calculator on the homepage, a link to on the homepage that will tell you if you're eligible for the credit, and if so, how much you might expect to get back. California Healthcare Coverage Guide is a separate website that we help run, which basically walks a small business owner through the whole process of buying insurance. So step one, does it even make sense for me to offer insurance financially? How do I make those calculations? Who do I talk to? How do I find a broker? What rules do I need to make sure I'm playing by? All those sort of things are answered in this pretty easy to understand step-by-step process for firms looking to offer insurance. There's a glossary on there. So if you're trying to figure out, what's the difference between a co-pay and co-insurance, all those sort of terms are kind of explained. If you are really interested in the stuff and you really want to get involved, the exchange's website's up there where you can see all their agenda and all their documents are public and everything, so you can really follow what they're doing. There's a mailing list you can get on if you want more information about what they're doing and whatnot. And then lastly is Health Law Guide for Business, which is another website that we help run, which basically just focuses specifically on healthcare reform and its impact on both small and large businesses, and trying to explain some of those provisions in the healthcare law. So with that, I'll wrap up and happy to answer any more questions that you all may have. If you're offering them insurance plan with all the bells and whistles that's going to cover everything, then that's probably, if they're minimum wage, it probably would be more than 9.5%. If you're offering them a more modest insurance product that's going to have lower premiums, then they might be okay. Yeah. Yeah, there's a lot of calculations that employers are going to have to make. Another thing to consider is if you are providing insurance to your employees, that's a tax deduction, right? If you pay the $2,000 penalty, that's not tax deductible. So if the insurance may be a little bit more than $2,000 per year per employee, we have to also sort of figure out the tax calculations, and it may be some businesses recently have been coming out publicly and say, hey, we've run the numbers and it's cheaper to buy the insurance than to pay the penalty. So it depends. Yeah, it's a good question. He asked about the penalty for individuals that are not insured, are not covered. So it kicks in 2014, and the penalty is sort of phased in. So the first year it's like $95. So not a lot, because the thinking is not everybody's going to know about it. Individuals. Yeah, and then it'll sort of go up for the next few years. I think it maxes out about $700 per year for those folks that are not insured. And the cost of health? Potentially. I mean, there's already been changes over the past 3 years. Like I mentioned, ever since the healthcare law was enacted, they started making changes to it, and they haven't stopped. So just past last month in the fiscal cliff discussions, there were some healthcare reform changes in there, and I'm sure they'll continue, until for a while.